Does this sound familiar to you? Life is going along fine. Then all of a sudden, there's something fishy, as in smells fishy. And not like fresh grilled salmon fishy, no, more like rotten fish fishy. Or maybe you just had a weekend of hot, steamy sex, but then a few days later, it hurts when you pee. Or when you go for a walk or exercise or just do about anything, it hurts. I mean, really hurts. And it feels like you've got a 4-alarm fire burning down there. Plus, you've got this strange-looking discharge, maybe, and you just want to curl up in a ball and hide. Does that sound familiar? Yep, that's right. I'm talking about vaginitis, yeast infections, bacterial vaginosis, and while we're talking, UTIs can be pretty painful as well. Look, not only will most women have to deal with these issues at some point in their lives, but many will get them over and over again for years. I know how vaginal health issues can affect women, not just physically, but sexually and emotionally. Women feel embarrassed, ashamed, dirty. They obsess that their partner will discover the odor or discharge and be turned off. It doesn't matter how confident you are. Frequent vaginitis takes a toll on a woman's self-esteem and sex life. They start to avoid sex, especially oral sex, too embarrassed and self-conscious and worried. They wonder why it keeps happening to them over and over again. And when it comes to treating vaginitis, they're equally frustrated by the products that treat symptoms, but do nothing to address why it's happening in the first place, the root cause of the problem. Well, all that worry and frustration may no longer be necessary because you can take your control back and break the cycle. Most women don't know it, but in recent years, there's been tremendous breakthroughs in women's health, a better understanding about why these issues happen and how to help prevent them. So that's what I'm going to be talking to you about. Yes, it's all things vag today, from vaginitis to the latest vaginal youth and beauty and much more. Hi, I'm Dr. Jennifer Berman. I am a doctor, a urologist in fact. Vaginal health as well as sexual health have been the focus of my career for over 20 years. Maybe you've seen me on the television show The Doctors, or perhaps you caught my television series on Discovery Health about all things sex and sexual health. If you have, then you know that I have spent my career investigating and reporting on the latest trends in women's health, the things that really work. Not a bunch of crazy home remedies, gimmicks, and hypes, though I'll talk about those as well because some of them do have some merit. You see, I'm constantly in search of women's health treatments and products that are not just effective, but also natural whenever possible, so you don't end up in the doctor's office on antibiotics or worse. I believe in a proactive approach to women's health. Holistic things women can do to help prevent these and other vaginal issues from occurring in the first place, including lifestyle tweaks in the bedroom and bathroom, even supplements that can make a big difference, life-changing stuff. I'll be talking about all of that today, including answering your vaginal health questions, the questions women are even afraid to ask their own OBGYNs. Now, as I share all of this information with you, it's important to take note that when it comes to vaginal infections, what we're talking about today is prevention, avoiding them in the first place. Should you get an infection, it is important to contact your doctor. I just wanted to make that clear. Okay? Ready? Let's get started. Here's what I'll be covering in this video. I compiled a list of some of the most frequently asked questions from women who reached out to me with their top vaginal health and beauty concerns. First, we're going to talk about something uncomfortable and really itchy that no one likes to talk about. Vaginitis. If you've had it in some form or you're experiencing symptoms right now, then the culprit is most likely one of these 3 things I've highlighted behind me. They account for 95% of all cases. I'll take you through each so you can easily identify which one you have should symptoms arise. And most importantly, I'll show you what to do to help avoid these from happening in the first place. Because when it comes to vaginitis, prevention is key. Okay. Now, the most common type of vaginitis is a vaginal yeast infection. How common? Super common. 75% of women will get at least one yeast infection at some point in their life. Doctors see tens of millions of new cases a year. Different than a bacterial infection, vaginal yeast infections are caused by a specific type of yeast called Candida albicans, otherwise commonly known as Candida. Now, we all have this yeast in our bodies, that's normal. But if it's not kept in check through certain healthy habits, which I'll cover in this video, then Candida yeast can grow rapidly and overpower the vaginal ecosystem, which is otherwise known as your vaginal microbiome, and cause an infection. In fact, it's not uncommon for some women to get 3, 4, or sometimes even more infections in a year. Next, I'll cover what you need to know about the second most common form of vaginitis called bacterial vaginosis, or BV for short, which, as the name implies, is a bacterial infection in the vagina. BV affects about 1/3 of all women, but that doesn't tell the full story. There's a much higher percentage in younger sexually active women and women in certain minority groups, and strangely enough, even higher in women who smoke. I'll discuss why these groups experience more BV in the video and how they can prevent future outbreaks. And then there's something called trichomoniasis. Doctors call it trick for short. Never heard of it? Well, many of its symptoms are similar to yeast or bacterial infections, but it's distinct in a few ways, and I'm going to show you how. Unlike the other two, trick is an STI. That means sexually transmitted infection. In fact, next to HPV and chlamydia, it's now the most common STI out there. So if you're sexually active, then you need to be aware of trick. Because for men, it can be asymptomatic, but in women, it's a very different story. And keep in mind, if you think vaginitis is just a short-lived inconvenience, albeit with some pretty horrible symptoms, but it's still short-lived, then think again, because it's not. If not addressed, vaginitis can lead to serious scarring of your reproductive organs, infertility, or even premature labor, and longer health term issues as well. Okay, next we're going to talk about birth control. Why? Because I find that women don't usually get the full picture from their doctors or pharmacists. I'm going to show you how using certain types of birth control can lead to unexpected side effects, including putting you at higher risk for BV and yeast infections, and which birth controls can lead to vaginal dryness. Speaking of that, I'm going to talk about a few common misconceptions when it comes to vaginal dryness and the discomfort it can cause, and how it's not just an issue of older women. Younger women are experiencing it as well. So stay tuned, because I've got some great tips for you later in this video that can make dryness an issue of the past. And next, we're going to talk about a concern that every woman has, and that's vaginal odor. That's right, how we smell. What odors are normal and what's not, and questions like, can they be prevented or changed? Should I eat more pineapple? Will that work? How about a cucumber cleanse? Yeah, that's a real thing too, that's trending on TikTok. We'll get into all that and much more. And by the way, when it comes to odor, please stay away from that aisle in the drugstore. You know, the one with all the douches and feminine sprays. Seriously, there's a right and wrong way to reduce odor, including, as you'll learn today, easy things you can do at home that can make a huge difference. Next, we're going to get into the heart of this video, what I call the secret. The vaginal health secret, that is, the most important part of this video. So please keep watching, at least until this part, because it includes the one thing every woman needs to be doing each day for a healthy, happy, and infection-free vagina. You're going to learn about certain things, 3 things in fact, that you absolutely must be doing every day to support your vaginal pH. My what? My vaginal pH? Yes, your vagina has a pH, and your OBGYN is very concerned about it, and you need to be too, because it determines whether your vagina is healthy or sick. Now, I promise this part won't be a chemistry class for you all over again, but you will learn that having a normal, healthy vagina comes from having a vaginal pH around 3.8 to 4.5, which, if you do remember from chemistry class, means an acidic environment. And that acidic environment is everything when it comes to your vaginal health. It's your vagina's natural defense system. It's all you've got to fight off bad bacteria, and it won't let you down if you treat it right. A vaginal pH above 4.5 is where you start to have problems. It opens you up to growth of bad infection-causing bacteria or yeast. I'm going to show you later 3 clear signs that your vaginal pH might be off and what you need to do to take action to get it back on track and keep it there, naturally, without drugs. And if that's not enough, I'll liven things up even more with everything you need to know about urinary tract infections, otherwise known as UTIs. Okay, it's not a joking topic, I know. UTIs can be nasty and plague women of all ages. Over 60% of women will have to deal with UTIs at some point. It has distinctly different symptoms and causes than vaginal infections. But much like vaginitis, once you get a UTI, the chances of recurrent urinary tract infections are much higher. You'll also learn why it's common for bacterial vaginosis to lead to urinary tract infections. After all, it's simple anatomy. All these holes are pretty close to each other, wouldn't you say? So if you swear that sometimes you get a UTI after sex, then you're probably not imagining it. So let's make it a goal to avoid vaginitis and urinary tract infections altogether, okay? And all the misery that goes with them. And I'm gonna finish it all up with my top 5. My top 5 vaginal and urinary health tips, including what I believe is the #1 most complete vaginal health support supplement out there, the first of its kind from the experts at LoveBug Women's Health. It's my go-to choice and the one I recommend for all my patients, women in their 20s and 30s, throughout their 40s, into their 50s, even teenagers. It's a must. It helps you maintain that healthy vaginal pH we discussed with clinically supported ingredients that have been shown to help lessen your chance of getting yeast infections, bacterial vaginosis, UTIs, and more. It can help with those troubling vaginal odor issues as well, while also preventing and addressing things like vaginal itching, burning, pain, and even discharge. And since a healthier vagina means a more youthful, moist, and supple vagina, they've got natural ingredients in there to help support that as well. We'll talk more about that later in this video. So that's the plan. Let's get started at the top with yeast infections and why they're so common. Now, whatever you may have heard, yeast infections have primary and secondary causes. The primary cause of yeast infections is not having enough of certain healthy bacteria in your vagina. Probiotic bacteria specific to your vagina and your vaginal microbiome. Yes, you've got healthy bacteria called probiotics in your vagina. In fact, next to your gut, you've got more bacteria, both good and bad, in your vagina than anywhere else in your body. Medical research has shown that it's your vaginal bacterial balance, maintaining enough healthy bacteria down there, that keeps your vagina acidic. You see, healthy probiotic bacteria produce lactic acid. Lactic acid acidifies the vagina, and it's that acidic environment that keeps yeast infections at bay. So if your bacterial balance is off, meaning you don't have enough healthy vaginal bacteria, it will cause your vaginal pH to rise, creating an environment for Candida yeast to grow quickly and take over all of your vaginal flora, and this is not good. And Candida yeast is a very opportunistic fungus. It resides in moist areas of your vagina, just waiting for an opportunity to strike. A moment of weakness, and they take over. The top risk factors for yeast infections all have one thing in common. They're all things that throw off that delicate bacterial balance. Here's a few. First is antibiotics. Taking antibiotics for something, anything for that matter, temporarily wipes out your good vaginal bacteria and puts you at risk. Next is using hormonal contraceptives. They also deplete your good vaginal bacteria, causing your vaginal pH to rise. Having diabetes is also a risk factor. It's well known that people with diabetes are more likely to have frequent recurrent yeast infections. The reason for this is simple. Yeast feeds off of sugar. So if your diabetes isn't well controlled, then blood sugar levels can spike. This increase can lead to sugar in your vaginal mucus, which causes yeast to grow. And as we discussed, a yeast infection is a response to that overgrowth. However, if your good vaginal bacteria is replenished daily with the right combination of vaginal-specific probiotics, like in the LoveBug's V-Best supplement, then you have that increased protection. Okay, next up is using douches and vaginal fragrance sprays. These products can strip away and throw off your vaginal bacteria, leaving you exposed to yeast growth. Don't use them. Big no-no. Another risk factor is what you wear. Tight underwear or clothes that don't breathe well create a moist environment. And sitting around in damp, sweaty workout clothes or a wet swimsuit is not a good idea either. Candida yeast loves moist and wet. Remember, it's opportunistic. Next one, you've probably heard this before. Don't leave tampons or pads in too long. This too can not only lead to yeast infections, but way worse infections as well. So be careful about that. And lastly, if you struggle with yeast infections, then you need to keep your immune system strong. A weakened immune system provides an environment for Candida to grow and take over. So what can you do? Getting proper sleep and exercise is a great start, but nutritional support really helps as well. Supplements like vitamin C, D, and garlic are important. Fortunately, all of these are in the V-Best Complete Vaginal Health Daily Supplement we've been talking about. And for many, yeast infections are something that just keeps coming back over and over again. When women ask me all the time, what's wrong with me? Why does this keep happening? Well, if this has been happening to you, then please know that there is nothing wrong with you, and you're not alone. Remember, I told you that 75% of women will get at least one yeast infection. But what I didn't tell you is over half of those women will get them over and over again. So this is a big issue for many women. Recurrent infections are no fun and can leave lasting damage. Fortunately today, we now know how to be proactive and what to do to help keep them at bay. So, if you've never experienced one, let me tell you what a typical yeast infection feels like. To begin with, it's usually not a subtle thing. You can pretty much tell early on something isn't right down there. There's usually swelling, pain, and itchiness, and not just everyday itchiness, extreme itchiness. And it has this signature weird discharge, thick and curd-like, much like the way cottage cheese looks. However, unlike a bacterial infection, which has a fishy odor, the smell of yeast is milder and somewhat beer-like, downright yeasty, probably why I don't like beer. Now, with the infection also comes a burning feeling in the vulva and the area around your vagina as well. I have a chart later on in the video which covers all the symptoms you need to be aware of when it comes to yeast infections. Okay, now on to bacterial vaginosis, or BV for short, which shares some of the same symptoms as yeast infections. This infection is also directly triggered by a rise in your vaginal pH, which in this case causes the growth of not just yeast, but certain bad bacteria that, like yeast, are only found in small amounts in your vagina, but they can quickly grow and become the dominant bacteria, and this results in infection when given the opportunity. This shows a normal, healthy vagina and one with BV. Again, without the protection of good probiotic vaginal bacteria, the bad bugs win. Again, a rise in your vaginal pH occurs when you don't have enough good bacteria down there, and most of your good vaginal bacteria, over 90% in fact, is in the Lactobacilli probiotic family. These Lactobacilli probiotics produce lactic acid, which acidifies your vagina, keeping it healthy. You can help avoid bacterial imbalance by taking a targeted vaginal health probiotic, like those in the one I recommend called V-Best. V-Best is loaded with the probiotics clinically shown to help counter BV. If you're low in vaginal lactobacilli, then you invite the growth of bad bacteria called anaerobes, including this nasty guy called Gardnerella vaginalis. He's the source of most BV outbreaks, pubic enemy number one. So here are a few things that can throw off your vagina's bacterial balance and lead to a BV infection. Hormonal changes from taking birth control pills, pregnancy, and even sometimes menstruation can throw it off. Like with yeast infections, douching or other excessive cleansing methods or fragrant sprays are bad and strip good bacteria and can make you vulnerable. Smoking. Women who smoke, even women exposed to secondhand smoke, are at higher risk for recurrent BV infections, more than twice the level of non-smokers. This is well documented. Smoking not only weakens your immune system, it actually creates vaginal secretions that attack healthy vaginal lactobacilli and promote bad anaerobe bacteria. Yet another reason to quit smoking. Now, unlike yeast infections, having sex with a new partner also puts you at increased risk for BV. BV is not a sexually transmitted infection, but many doctors believe that exposing yourself to a new partner's genital chemistry can somehow alter your vaginal bacterial balance enough to trigger a BV infection. And lastly, improper hygiene. This can also cause it, such as wiping back to front or having anal and vaginal sex without cleaning up in between. You'd think this one would be obvious, but I told you how many times I've seen patients that don't take that into account. Okay, so bottom line on BV. Though BV is less common than yeast infections, it's still very common, and many women will suffer from frequent recurrent infections. Recurrent BV infections are very frustrating and can destroy a sex life, so it's really important to take measures to help avoid BV altogether. Here's what I recommend. Use condoms. Like with yeast infections, avoid sitting around in wet, damp clothes and dry off completely after sweating so your vaginal area isn't moist for long periods of time. And of course, take a targeted vaginal health probiotic like V-Vest. How do you know if you have BV? Well, it's easy. With BV, the giveaway is a grayish-white discharge that smells fishy. It's very distinctive. In fact, as doctors, we actually use something called the whiff test as one of the ways of diagnosing it. The other test is to measure the vaginal pH and see if it's above 4.5. With BV, you'll also have itching, typically burning sensation when you pee, plus swelling in the vulva and vagina, and it gets worse. It's not fun. And BV can also lead to more serious conditions. It's been linked to pelvic inflammatory disease, which, if left untreated, can lead to infertility. It can also cause inflammation of your endometrial lining, which is called endometritis, and it increases the risk of you acquiring sexually transmitted infections. It's also known to cause spontaneous miscarriages, which is why if you're pregnant, it's really, really important to avoid getting BV. And one last comment on BV. As I mentioned earlier, studies have shown that Black women are disproportionately affected by BV, and they are more likely to suffer from recurrent breakouts. Research as to why this is the case has shown that every ethnicity has slightly different vaginal floras. And unfortunately, many Black women simply have a lower number of lactobacilli bacteria in their vaginal flora, which leaves them less protected against BV. This is easily addressed, however, by taking a broad-spectrum lactobacilli vaginal support supplement like V-Vest daily. And while I'm talking probiotics, I want to take a moment to explain what I mean by taking the right vaginal support probiotic supplement. When choosing a vaginal supplement, ingredients matter. If you don't have the right probiotic strains and support ingredients in there, and enough of them, then it won't be effective. V-Best has 7 different strains of the most important vaginal probiotics, over 70 billion colony-forming units altogether. These are very specific probiotics that, 1, replenish the specific good lactobacilli bacteria strains in your vagina that get depleted, and 2, includes unique, clinically tested probiotic super strains that provide an added boost of support to your vaginal microbiome. This combination is really important to have, especially if you're a recurrent sufferer. I bring this up because many supposed vaginal health probiotics out there contain cheaper general probiotics, not targeted vaginal probiotic strains. This is important. All you need to know here is that there are different probiotics for different purposes, and not all strains and species of probiotics reside in your vagina. For example, many bacterial strains live primarily in your gut, not in your vagina. So Taking a supplement with the wrong probiotics may help with your digestion, but it will do little to help you avoid BV or yeast infections, and it certainly won't promote an overall happier, healthier vagina with normal discharge. I hope that's clear. I just don't want to see anyone waste their money on products that don't work. Now, the third most common type of vaginitis is called trichomoniasis, or trick for short. This one tends to fly under the radar, but cases are on the rise because condom use is down. And as I mentioned earlier, many of its symptoms are similar to yeast or bacterial infections, but there are a few distinct differences that make it obvious that you have trick versus something else. Trick is a sexually transmitted infection caused by a parasite called Trichomonas vaginalis. This is the nasty little bugger here. Once a woman is infected with trick, it quickly spreads in the vagina and goes up the vaginal walls. Now, I want to be clear on one thing about trick. It is not a good idea to try and treat this yourself with any home remedies. If you get trick or think you have trick, then targeted antibiotics are needed. I know, I don't love antibiotics either, but they are needed and will wipe it out quickly and get rid of it. People have claimed success treating trick other ways, using everything from black tea to grapeseed extract and other crazy things. However, to date, antibiotics remain the only reliable, effective treatment for trichomoniasis. So see your doctor if you have trick symptoms. If you do have it, then you're going to be put on antibiotics, and it's really important to make sure you're also taking a probiotic like V-Best to replenish your healthy vaginal flora. Okay? You don't want to mess with this. So what does a trick infection look like? With trick, your discharge will be different than if you have BV or a yeast infection. It will be a more frothy green discharge that has an unpleasant but more mild odor than BV. You won't have much itching with trick, but you will have a burning sensation, swelling of the vulva, and even pain when you urinate or during sex. Avoiding trick is easy. Use condoms during sex. That's all you have to do. But if you don't, then keep in mind that if your asymptomatic male partner, and men usually are, doesn't do anything about his trick, then you'll just keep getting it over and over again. Enough said. Okay, let's talk birth control for a minute, or more specifically, what they often don't tell you about birth control and vaginitis, and that's this. Many hormonal birth controls can throw off the balance in your vaginal microbiome, enough to make you more prone to overgrowth of yeast and BV. And vaginal dryness is another common side effect of these birth controls for the same reason. They throw off your vaginal pH. The two most common types of pills are the mini pill and combination pill. The mini pill contains just one hormone, progestin. The combination pill contains two hormones, estrogen and progestin. Both types are effective and safe for birth control, but again, you need to know that both can throw off your vaginal bacterial balance. The solution is obvious. Adding V-Best to your daily routine will help keep your vaginal microbiome in balance and your vaginal pH exactly where it needs to be. And if you still have vaginal dryness, consider trying a water-based lubricant. Another common cause of vaginal dryness, known as dating the wrong person, well, that's one you need to address on your own. Okay, now let's talk a little more about vaginal discharge. I frequently say vaginal discharge is normal, except when it's not. Vaginal discharge is the mechanism the vagina uses to keep itself clean and healthy. Think of your vagina much like a self-cleaning oven. Normal vaginal discharge, as you learned today, is acidic, and that's why it can discolor your underwear, in case you were even wondering. Again, that's normal. You don't need to call your doctor for that or when that happens, but you do need to know what abnormal discharge looks like and smells like and what causes it. I've covered this already for the 3 different types of vaginitis, but if you'd like to learn more about this, I have a comprehensive chart later on in this video showing different types of discharges as well as the causes. Again, remember, for your best normal discharge and odor, keep thinking dry down there, avoid wearing tight-fitting clothing for long periods of time, don't smoke, and of course, take a vaginal probiotic support supplement daily. It's pretty simple, right? So now you know what doctors know. Maintaining a healthy, acidic vaginal pH is a path to a happy and healthy vagina. I've shown you how to do that today with proven methods. Now let's have some fun and take a look at a few unproven methods, some of the top vaginal health myths and urban legends that are out there. Okay, right at the top of my unproven list are the crazy things people stick in their vaginas, often learned from a YouTube video. All right, myth number 1, inserting food into your vagina to treat vaginitis. The 2 most common videos you'll find on this topic is tips for inserting garlic or yogurt into your vagina. And I can assure you, no one with a medical degree is posting these videos, though I sadly see that they're out there. Let's start with garlic. Now, garlic does have many beneficial health properties from something called allicin, which is the active component in garlic. Allicin has been shown to help stop the growth of candida, which is responsible for yeast infections. But sticking garlic cloves into your vagina is not a good idea and may make an infection worse. If you want the benefits of garlic for your vaginal health, it's already in the best formula. So keep the garlic cloves in the kitchen where they belong. Now, on to inserting actual yogurt into your vagina, or yogurt with honey, which seems to be pretty popular also. Now, I love yogurt, especially with berries in the morning. It's delicious. And if you're messing around with your partner, enjoying a little vaginal food play, then okay, go for it, but just clean up afterwards. But like garlic, it's the right idea maybe, but not the right way to get probiotics into your system. Just do it the right way, please, with a supplement. And if you're still tempted to insert a little of your fave yogurt, then know that lactobacilli probiotic strains in yogurt are not the same strains that populate a healthy vagina. And multiple studies have shown that putting yogurt into your vagina simply doesn't work. Fortunately, all the strains of targeted lactobacilli, vaginal probiotics you'll ever need are in the best, with no fuss and no mess. Okay, moving to myth number 2. That's right. People are actually out there doing vaginal cleanses with these guys. This trend started on the West Coast. I suppose one day someone was drinking a cucumber water and thought, you know what? Maybe I'll try that. Apparently, the vagina cucumber cleanse detox, or whatever they're calling it, involves peeling a cucumber, sticking it into your vagina, twisting it for 20 minutes or so. Again, this is another really bad idea. Like all the other weird vaginal cleanses out there, it's a bad idea. There's absolutely no evidence to support that this does anything positive. Now, what inserting things into your vagina can do is irritate and damage your delicate vaginal mucosal tissue and interfere with your good vaginal bacteria, which, as you know, can lead to a BV or a yeast infection outbreak. So this is a no-no. Okay. Myth number 3, and this is a big one. This one involves the misuse of something that I am okay with using in your vagina and inserting inside of you, but only if you do get a yeast infection or bacterial vaginosis outbreak. I'm talking about boric acid vaginal suppositories. You see, boric acid is effective at quickly normalizing vaginal acidity, but it's harsh to your system. So you can go ahead and keep it in the medicine cabinet just in case. The problem is that some companies suggest women use boric acid suppositories on a regular basis as a preventative measure, such as after sex. This practice is not okay, and it's my myth number 3. Regular use of boric acid suppositories. Don't do it. Now, vaginal myth number 4 certainly sounds like something exotic and maybe even fun, but like the others, it can be harmful. It's vaginal steaming. This one somehow caught on in recent years, but as I mentioned earlier, your vagina is for the most part self-cleaning. And you need to be very careful not to do or use anything harsh down there. Steaming can actually throw off your vaginal bacteria and also cause a rash or even a burn. So when it comes to steam, stick to steaming your clothes or your carpets, maybe that's a better idea. Okay, my 5th and final urban myth. Myth number 5 is the one about eating pineapple to give your vagina a sweet taste. This one has been around for a long time, and kudos to the creative pineapple execs that came up with that idea. It's brilliant, but sorry, folks. Just because asparagus makes your urine smell funny and eating garlicky food gives you bad breath, that doesn't mean that all foods have this ability. Pineapple won't sweeten your vaginal juices. Eating pineapple is great for you in general and for your general health. It's loaded with vitamin C and potassium and other good stuff, but that's about it. There are certainly many more vaginal health myths out there and old wives' tales, many even crazier than these. I may even do another video on them one day, who knows. Suffice to say, when it comes to your vaginal health, please stick to advice from medical health care professionals. And as a urologist, while I'm down there talking vaginal health, let's talk about another common urogenital issue. Okay, ladies? Anatomy 101. You've got 3 holes down there, and they're all pretty close. So there's another very common potential bacterial issue you need to be diligent about, right here. The dreaded urinary tract infection, or UTIs. UTIs occur when bad bacteria like E. coli and other bad anaerobes get in there. And they're super common, as you probably know. Most women will have to deal with UTIs sometime in their life, and not just once. Recurrent UTIs are very common. Once you get one, it's easier to get another. Now, there are many ways you can get a UTI, from hygiene issues, such as wiping back to front after you have a bowel movement, or you can get it from sex, or you have some other kidney or urinary tract issues, and other ways as well. Even things like not emptying your bladder completely when you pee can trigger a UTI. Fortunately, there's good news today when it comes to UTI prevention: easy nutritional solutions. Here are the top nutritional ingredients for UTIs, and guess what? They are all in V-Best. In fact, V-Best may be the most complete UTI prevention support formula out there. The first thing you'll need to help prevent future UTIs is targeted probiotics. That's right. Probiotics again. You see, all your urogenital flora should be predominantly made up of the same lactobacilli probiotics we discussed earlier. They push out uropathogens like E. coli that are responsible for almost 95% of urinary tract infections. Next up is cranberry. Now, I don't advise drinking cranberry juice because it's usually loaded with sugar and not potent enough. What I'm talking about here is a concentrated full-spectrum cranberry extract called Pacran, which was clinically proven to reduce the rate of UTIs by directly reducing E. coli levels. Then there's that garlic extract again. I talked about it earlier. It has antimicrobial properties that even further helps to block the growth of bad bacteria. And lastly, combining these 3 with vitamin C helps keep your urine naturally acidic. And this has been shown to be a powerful combination for supporting your urinary tract health. Again, you don't have to worry about searching all these things out individually because you get all of them in V-Best. Okay. We're getting towards the end of the video, but before I conclude with my all-time top 5 vaginal health tips, I want to talk for just 2 minutes about a link between fertility and vaginal health that many women might not be aware of. Look, you might not be interested in children now, but I find that most women don't want to close the door to that option. So you need to know that fertility issues are on the rise. However, there are 2 words that are synonymous with both fertility and overall vaginal health, and that's cervical mucus. What is cervical mucus and why should you care about it? If you don't know, it's a fluid produced by your cervix as you approach ovulation. It's the discharge you see in your underwear at that time in your cycle. Now, you probably noticed it changes, right? When it begins, it's a little sticky. Then it becomes more like creamy lotion, and then it eventually becomes more like raw egg white, kind of stretchy and see-through, a bit watery almost. In the fertility world, this is known as egg white cervical mucus, or EWCM for fertility insiders. This is your most fertile cervical mucus that shows up right before ovulation. The reason this mucus enhances fertility is that, unlike the sticky variant, it nourishes sperm and allows that sperm to get through your cervix easily toward your fallopian tubes. So if you may want to get pregnant in the future, then you really need to ensure you have that healthy EWCM when you're ovulating. Okay, now guess what ruins the health of your cervical mucus? That's right, vaginitis, like yeast infections or bacterial vaginosis, they destroy cervical mucus as well. No EWCM when those bad guys are around. Vaginitis can also make you temporarily infertile, and it can have lingering effects as well. So a large part of having healthy cervical mucus is dependent upon having healthy normal vaginal pH, which you now know comes from having healthy vaginal flora. So support that flora by taking a targeted vaginal probiotic supplement like VBest. 2 other things you need to know about your cervical mucus. Hydration is also important, and so is vitamin D. In fact, to assure that you're producing healthy cervical mucus, you need to keep your vitamin D levels up. Getting adequate vitamin C and E also helps, but vitamin D is even more important. Fortunately, you get all of these things in VBest. As I said before, it really is a complete vaginal and urinary health support supplement. Okay, time for my top 5 vaginal and urinary health tips. Number 1. I talked about this one a few times earlier in the video, and that's practicing proper vaginal hygiene. I know it can be tempting to reach for that fragrant cleansing product when you have symptoms of vaginitis, but again, those fragrant vaginal washes and sprays, douches and scented tampons can disrupt your vaginal pH. Avoid them altogether. Number 2, be mindful of your underwear and clothing choices. Hey, sexy lingerie is fun. Fortunately, it doesn't stay on too long, but you need to look at your day-to-day clothing, especially your underwear. It can affect your vaginal health and throw off your vaginal pH. So here's what I recommend. Wear underwear that's made from natural, breathable, absorbable fabrics like cotton. Wash your underwear in hypoallergenic detergent. Go panty-free at night, or as much as possible, in my opinion, to prevent moisture buildup. Change your underwear during the day, especially if you notice a lot of moisture buildup or irritation or menstrual flow. Avoid wearing tight-fitting or restrictive clothing for long periods of time, and don't hang out in your wet swimsuit or sweaty exercise wear after the gym. You can still look great while keeping things breathable and fresh down there. Okay. Number 3, use condoms. In addition to avoiding STIs like trich, the form of vaginitis I discussed earlier, semen has an alkalizing effect on the vagina, which increases your risk for BV. There are some great condom options out there. Find one that works best for you and your partner and use them. Number 4, quit smoking. And if you need yet another reason to quit, as I mentioned earlier, smoking directly affects your vaginal flora, making you more susceptible to infections like BV and yeast. Okay, number 5 involves 2 easy things you can do to help prevent UTIs. 1, make sure you urinate when you feel the urge, don't hold it. And 2, urinate before and after sex. And a bonus tip, saving the best for last, tip number 6, take VBest from LoveBug Women's Health. It's the vaginal and urinary health daily supplement that I recommend, with those clinically tested probiotics we discussed earlier for addressing yeast infections, bacterial vaginosis, UTIs, and more. It is hands down the most complete formula out there. Now, before I sign off, as promised, here's a summary table that you can also find on the website by clicking on the link below. If you have pain or other discomforts in your urogenital area, then it's most likely one of these 4 things. Fortunately, it's fairly easy to determine which one you have based on your symptoms. For example, if you're experiencing a grayish-white discharge with a fishy odor, then it's probably BV. A cottage cheese-looking discharge, then it's probably yeast. A green discharge with a little odor, it's most likely trich. And a smelly urine with intense pain, then it's a UTI. I've taught you all these things, hopefully, in this video. So it's best to avoid these altogether, wouldn't you say? So, if you're ready to start living without vaginitis or UTIs disrupting your life, affecting your confidence, relationships, and even your self-esteem, then click on the link below to learn more, because it's time to break the cycle and stop the misery. LoveBug has been a leader in vaginal health supplements for over 6 years, led by VBest with clinically studied ingredients and targeted probiotics specifically designed to address yeast infections, BV, and other types of vaginitis, as well as UTIs. Just click on the link below to find out more, including a special offer to get started with VBest. Thank you for watching this video on vaginal and urinary tract health. I'm Dr. Jennifer Berman, and I'll see you again very soon.